depression and anxiety. We talk about depression and anxiety because they both do cause different effects on the heart, and usually in a negative way. Some people have clinical depression where you're already on medications, but some depression is caused due to you finding out that you have heart disease, and then we worry about, will our life be the same due to a heart attack or bypass surgery or valve surgery or whatever diagnosis you may have. Depression is common in cardiac patients. We like you to know that it's normal, and usually more than 50% of the patients do feel it at some point, but over time it will get better. The emotions you feel can affect the recovery, and if we don't get it under control and be aware of it and talk about it, it can be in a very negative way that it affects the recovery. First, I want to give you some facts about depression, and it's not to scare anybody, but it is some of the research that the American Heart Association has found through the research of how this does affect patients. Heart disease patients who have anxiety have twice the risk of dying from any cause compared to people that don't have anxiety. Patients that have anxiety and depression triple their risk of dying if we don't pay attention to this and get it taken care of, talk to a doctor, and possibly use medications if that's what we need, even if it doesn't long-term medicine, but short-term medicine. Depression is 3 times more common in a heart attack patient, and a lot of that is related to, will I be able to return to my normal life? Depressed heart patients often also have anxiety, so now the anxiety is considered just as much as important as depression. And where the anxiety comes in is you guys become very in tune to what you're feeling in your chest. If you're having chest pain, chest discomfort, shortness of breath, and so then every time you have a discomfort in your chest, even if it's very quick, you're afraid it's always your heart. So that's one reason cardiac rehab is good, because we want to make you comfortable with you distinguishing, is this my heart, is it not, and getting comfortable with what you're actually feeling. Depressed cardiac patients have at least twice the risk of a second event in the first 1 to 2 years after having a heart attack. Severe depression is associated with earlier and more severe second cardiac events. So when you are considered in a severe depression, if it be through a doctor recognizing it, family, or even you recognizing that you have a severe depression, it needs to be looked at either by your primary care doctor or getting hooked up with behavioral health physicians to possibly get you on medication, if that be, again, short-term or long-term. Depressed patients are less likely to take their medicines or eat correctly or exercise, and definitely won't attend cardiac rehab. And that's just lack of motivation. You're withdrawn from people, so you just won't do the right things. The 2 important ones that I found new that were new on the American Heart website this year from last year is that women 55 and younger are twice as likely to suffer a heart attack, die, or require stent or bypass if they are depressed. And that's huge when you're 55 or younger. And then in that same age group, women are also more likely than men and older women to suffer from depression, which may be what they call a hidden risk factor that helps explain why more women die after having a heart attack. So those are just some statistics of what they have found through their research and why it's important to get under control. What are some of the effects of anxiety and depression? Anxiety increases you producing your adrenaline. So again, our heart rate goes up, our blood pressure goes up, makes that heart work harder. And when we know someone has coronary artery disease, we don't want your heart to work that hard unless you're actually exercising or doing a strenuous activity. People that worry a lot have more difficulty sleeping, which then when you don't get enough sleep or you're having trouble sleeping, your blood pressure's too high. And when the blood pressure's too high, again, that heart is overworking. And if you don't get the depression under control, they have found that you have a poor prognosis of living a good, long, healthy life, because people with heart disease can have a very normal, long, healthy life when they get that depression, anxiety under control. A lot of depression is related to behavioral factors. So it's a matter of behavioral of smoking and eating the right things and getting in the routine of exercising. And again, exercise has been proven to help depression because it helps that blood pressure come down. It decreases any stress, and it will decrease any anxiety you may have. The emotions that most heart patients feel, and everyone's different, but you're afraid because we know the heart's the most important organ in our body. It makes us continue life, and so you're afraid, will I die? Will another heart attack happen? The anxiety of getting comfortable with what you're feeling in that chest. We have to get that under control. There's a lot of depression because some people are worried they can never go back to their normal life. They feel lonely and they get angry, feel like you're the only person out there. And my belief, and Amanda and Dennis, when we do education, we don't believe a patient should be perfect on their diet. We believe in treating yourself. And if I told you all to be perfect all the time and you knew I wasn't a heart patient, that's what I have found make patients angry. And then that's when they quit and they tell the medical profession, you don't understand, you're not a heart patient. So we are trying to deal with teaching you the right things.
Your mic's flipped upside down here.
Oh. I want to say that statement over again.
Back a little bit there. There we go. I was like, I heard some big pop. I was like, what was that?
Oh.
Saw it roll over.
Oh, okay.
All right.
So we don't want you to get angry and give up and not take your medicines, not exercise, not eat right. It's a matter of baby steps. One thing I've learned the longer I've been a nurse and especially worked with heart patients, it's baby steps. Rome was not built in a day. And some people have the personalities to, as soon as they find they have heart disease, they go out and they change everything immediately. They won't eat any bad stuff. They go cold turkey on their smoking. They start exercising immediately. And that's great if you have that type of personality. But other people say, whoa, this is too stressful. You're telling me I have a bad heart, and now you want me to quit smoking and do this. So some, it's just a matter of making one step, saying, okay, this is what I'm going to do. And a perfect example is you make the choice of changing your life by walking through the doors of cardiac rehab. And once you feel comfortable with that, we get you feeling better after a few weeks. We hope then you look at some diet changes or maybe possibly stop smoking or losing weight. So it's baby steps, and any step makes a difference. It's important that you look at how they determine depression is looking at how have you felt over the last 2 weeks. Are you doing negative things? If you're looking at you're doing negative things such as smoking and eating junk food, that is a sign. Are you withdrawing from people, not going out having fun, doing social activities with family and friends? If you're answering yes to that, then possibly you do need some extra help with some medicines. Now, unfortunately, some of the medications for depression and anxiety, some people think they're taboo and they're all bad and they make you quote unquote crazy or look crazy, when in reality they're not. They're the best thing for you. And one thing I've learned in cardiac rehab with patients is you guys are each other's best cheerleaders, because y'all are coming in cardiac rehab at different levels. Some of you are coming out at a beginning level straight from surgery or straight from having a heart attack. Some of you are halfway through the program and others are getting ready to graduate. And you guys help each other, because as you see someone struggling physically or emotionally, what I've noticed what you guys do is pat each other on the back and say, you know what? I know exactly how you feel. I was there once. And what I've seen is that helps you more than myself. I compare heart disease to cancer. We can empathize and sympathize, but unless we've really gone through the physical or emotional aspect of it, we truly don't understand. Myself, Amanda, and Dennis, working in the field, we can help you with the depression, anxiety, and get you down the right road and hooked up with people that can help you, if it be a medical doctor or behavioral health. But at the same time, But we don't understand because we are not the heart patient. If we're the patient, we can understand. So you guys help each other, because all of you, no matter what degree of heart problem you've had, you all feel the same thing. So you guys are each other's support system the best. What to do if you find that you have the depression, anxiety is obviously talk to healthcare while you're in cardiac rehab. Talk to myself, Amanda, our dentist. We'll either talk to your primary care or possibly just connect you with the social worker. Social worker will give resources and also help get connected down the other paths. Find someone you can confide in, if it be family, friend, someone at your church. Exercise, be active. That will definitely help the anxiety aspect. And recognize that depression is a serious condition that can hinder your recovery. Find a good support system, if it be us here or if it be a family, friend, church. Anger, the anxiety, the depression, it all affects the heart. Again, it does elevate the blood pressure, increases that heart rate, which can make you have angina or chest discomfort, and makes that heart work too hard. And in reality, we don't want any of that going on. And anxiety will do the same thing. One thing I say to heart patients, there's very few heart diagnoses out there today that will not allow you to return to your normal life. Life will be the same, maybe not now because you just had open heart surgery or you just had a heart attack, but over time, I always tell people, if you used to, as a hobby, jump out of an airplane, you will probably go back and jump out of an airplane. There's very few heart conditions that will cause you not to have a normal life again. One thing I learned from a prior nurse, and when I heard this from the nurse, my mouth fell open because she was telling it to a patient I was working with. She said, if I had a choice in any disease out there, I would choose heart disease. And when I heard her say that, my mouth dropped open and thinking, what is she saying? But then she explained that. With heart disease, you are given a second chance in life. What you do with that second chance in life is your decision. Will I try and quit smoking? Will I change my diet? Will I exercise? Will I control my diabetes? Whereas with cancer and all the lung diseases that are out there and MS and muscular dystrophy, people aren't necessarily given a second chance. With heart disease, you are given a second chance. So it is up to you, and you guys are each other's cheerleaders.